Hi, my name is Sarah McLeod, and I am your host for Proven Cures, and today is Saturday, April 20th, 2019. It is also Easter weekend, so happy Easter to all my Christian followers, watchers, subscribers. There was also, I believe yesterday was Passover, so happy Passover celebrations to all the Jewish people who may be watching. I don't know if there are any Muslim holidays, but it's so happy holidays to everyone. Thank you for tuning in. Today is also, it's April 20th, so it's known traditionally as 420, which is the National Marijuana Smokers, I think International Marijuana Smokers holiday as well. And I was originally going to focus this video today on clinical studies of cannabinoids, but one of my subscribers asked me to, quite some weeks ago actually, asked me to do some research for her on nerve pain. And I'll admit, when I first got that request, my heart kind of sunk, because I really thought it was going to be exceptionally difficult for me to find a natural therapy for nerve pain. And it actually surprisingly did not take me long at all. It is something that more than likely you've already heard about, but you've heard about it being used as a treatment for depression. Well, depression is a symptom of a problem of the central nervous system, actually. And so it's not so far-fetched when you think of it that treatment, a natural therapy for depression, can also be useful for nerve pain. So get out your pen and paper at this point. I'm going to talk to you today about something called St. John's wort. I'm sure you've heard of it before. Like I said, it also has a scientific name, and that scientific name is Hypericum, Hypericum Perforatum, Perforatum. And the title of the study is Hypericum Perforatum, St. John's wort, as a possible therapeutic alternative for the management of trigeminal neuralgia. Neuralgia is just a medical term for nerve pain. And this is actually a case report. So it's just a report of one woman's battle with nerve pain and how she defeated it by using St. John's wort. This publication, this article is published in Complementary Therapies in Medicine, volume 30th, pages 36 to 39, and in the February 2017 edition. The contributors are Khalil Asiri, Yagub Alyami, James Uyanik, and Marcela Romero Reyes. This case report actually came from the NYU Orofacial and Head Pain Service, Department of Oral and Maxillofacial Pathology, Radiology, and Medicine at NYU's College of Dentistry here in New York. And currently at Rutgers School of Dental Medicine. So I'm not sure if an expanded study was also being conducted at Rutgers School of Dental Medicine, but that is also listed here as a contributor to this publication. So to make a long story short, it is a case report of a woman of Latino descent, 53 years old, who presented to the clinic with orofacial pain and had a history of trigeminal neuralgia. The patient was not able to get an appointment soon enough with the clinic and decided to take an over-the-counter homeopathic preparation of St. John's wort, Hypericum Perforatum, since she found that on the internet that it was reported to be effective for nerve pain. And what happened as a result, the patient responded dramatically to the Hypericum Perforatum preparation. The use of this homeopathic preparation completely relieved the trigeminal neuralgia pain. And that is actually a diagnosis for which pain management is considered considerably difficult. So after being given traditional therapy, it normally comes right back and maybe even stronger than before. So right now, just based on this one case report, St. John's wort is considered to be a very promising therapeutic option for people with trigeminal neuralgia or nerve pain. So that's not a lot of information. That is just an intro to a possibility, right? So I did some more research for you, and hold on, I'm pulling everything from the different publications that I pulled up on my phone. So just bear with me while I go through this, because I don't want you to run out and get St. John's wort capsules. It is something that can be very, very dangerous when consumed internally, especially if you are on any other kind of medication. And that's kind of what I want to go through right now. But I'm trying to find the article. So my suggestion is to purchase St. John's wort as a topical extract, something in liquid tincture form that you can apply directly on your skin wherever the nerve pain is focused. Don't consume it. There have been countless cases of contraindications with other medications with people, and it's caused a lot of serious problems. So the reason why I'm telling you not to consume St. John's wort in pill form is because it metabolizes other drugs really fast. So it decreases their effectiveness. And I'm going to list these drugs out. Actually, women who are on oral contraceptives really shouldn't swallow St. John's wort, because it has been linked to causing breakthrough bleeding and causing the pills basically to be ineffective as well. And here are the list of other drugs that it's contraindicated with if you take it internally. Okay, these are HIV protease inhibitors, including indinavir, crixivan, and nevirapine. It is contraindicated if you take cyclosporine, tacrolimus. I believe that is for fungus. Irinotecan, IRINOTECAN. Imatinib, docetaxel, which is a chemotherapy agent, and methotrexate. It is contraindicated with diltiazem, nifedipine, warfarin, and clopidogrel, blood thinners. It is contraindicated with triptans, SSRIs, including citalopram, fluoxetine, I can't pronounce this, FLUVOXAMINE, paroxetine or sertraline. It is contraindicated with tricyclic antidepressants, zolpidem, alprazolam, dextromethorphan, and antipsychotics such as clozapine. I already spoke to the oral contraceptives. It is contraindicated with statins, including simvastatin, atorvastatin, and rosuvastatin. It is contraindicated with oxycodone, gliclazide, PGP substrate drugs, including digoxin, telenolol, and fexofenadine. St. John's wort may also cause serious adverse effects in conjunction with pegylated interferon alpha, uridine 5-diphospho, oh my goodness, glucuronosyltransferase substrates. St. John's wort was also shown to modulate these enzymes in vitro and may therefore increase the side effects of drugs such as acetaminophen. So it has very serious potential interactions with a variety of drugs, and so it is very dangerous to take internally. Of course, if you're not taking anything, then hey, why not give it a try if nerve pain is your only problem? But nerve pain is usually accompanied by other issues as well, including diabetes and many other things. So that is why it was really important for me to share that drug list with you. But I also want to say that A lot of herbalists prescribe or recommend St. John's wort to help soothe and ease pain. It is really awesome for nerve pain, sciatica, Bell's palsy, head and spine trauma, pinched nerves. It's useful for any pain experienced after surgical and dental work, as well as injuries to any area that has nerve endings. So once again, I am recommending you to purchase this as a topical agent. It's awesome when used topically to treat damage for nerve endings, and it also benefits the skin topically in wound repair. It's useful as an anti-inflammatory agent to hasten healing and soothe the pain of burns, cuts, wounds, insect bites, and even varicosities such as hemorrhoids and varicose veins, as well as bruises, strains, and muscle pains. It is also wonderful as an antiviral and analgesic for eardrops. I am getting this information from an article titled St. John's wort, Not Just for Depression. You can look it up for yourself. It is posted on, let me see here, the Herbal Academy.com. St. John's wort, not just for depression, the Herbal Academy.com. Okay, so I hope this is useful to anyone out there suffering from nerve pain or neuropathy, and tell me how it works out for you, and be blessed. Thanks for watching, and subscribe. I always forget to say that. Subscribe to Proven Cures, and make sure to hit the bell so you can get a notification of my next video. Thank you. Bye-bye.